Hello, everyone, from the World Health Organization headquarters in Geneva. My name is Alexandra Kuzmanovic, and it's Wednesday, so it's our time to answer your questions about COVID-19. Today, I'm joined by Dr. Mike Ryan and Dr. Maria van Kerkhove. They will be answering your question about COVID-19 epidemiological update, COVID-19 variants. So please, as usual, ask your questions using the hashtag AskWHO if you're watching us on Twitter. If you're watching us on Facebook, LinkedIn, or YouTube, please write your questions in the comment section. Good afternoon, Mike, Maria. Thanks for your time. I know it's been quite busy, and in previous weeks we had a program budget and administration meeting, and then the World Health Assembly, so we weren't having any of those sessions. So as we had a couple of weeks break, can you please start with epidemiological update? How is the situation globally? We are seeing overall cases going down, but some countries are having high surge in cases. So can you please brief us where are these hotspots and what are the drivers of transmission at the moment?
We're rusty. We haven't been here in a couple of weeks. So thanks, Alex, for having us back again. Yes, you've indicated and you've highlighted that at the global level, we are seeing a decline in cases. And this is for the past 4 or 5 weeks where we've seen at the global level a decline in cases. However, if we look at regional levels and if we look at national levels and even at subnational levels, there's quite a difference in terms of the intensity of spread around the world. And that's been a consistent message that I think you've heard from both Mike and me and the Director General since the beginning of the pandemic. It depends, really where you are. So globally, last week we had a 15% decline in cases, and I'm looking at our SITREP that we published last evening. And across most regions, we have seen a decline over the last 7 days, with the exception of Africa and the Western Pacific, where we saw a 22% increase in Africa and a 6% increase in the Western Pacific. But again, if we look at each individual region, I think you'll remember, and many people have been focused on India, and previous to that focused on Brazil, where we've seen really intense outbreaks, really intense transmission. In each region of the world, there are hotspots. In each region, there are countries that are really facing very, very challenging situations with increases in transmission. And it's being driven by a number of factors. The first factor is that we see these virus variants that are being detected around the world. And currently there are 4 variants of concern that are circulating in different parts of the world. Each of these variants of concern have increased transmissibility. And if you have increased transmissibility, it means more people will be infected, which will burden your healthcare system. It really overwhelm the systems that are set up to find cases, isolate cases, care for cases in hospitals, carry out contact tracing, all of that. It's driven by the relaxation of public health and social measures and increased social mobility, increased social mixing. So the more you come in contact with someone, the more opportunities you have to be infected. If the public health and social measures, the physical distancing, the mask wearing, limiting your time indoors as opposed to outdoors, et cetera, if that's not in place, the virus can spread. It's also driven by uneven and inequitable vaccine distribution. And so the vaccine coverage around the world, although there's been more than 1 billion doses, 1.5 billion doses administered to date, that's really limited to a number of countries, and high-income countries for that matter. So we're not seeing the level of vaccination coverage that we would like around the world, focused mainly on high-risk individuals, so people, health workers, and those who are over 6 years old, those with underlying conditions. This combination of factors, relaxation of public health and social measures, increased social mobility, virus variants, and uneven and inequitable vaccination, is a very dangerous combination. 18 months in, we're all tired of this virus. It's not done with us yet, and if we give it the opportunity to spread, it will. So there are some challenging situations in many regions around the world, in particular in South America. We're seeing a number of countries that are seeing really intense transmission. I advise, if people are really interested to know exactly where, to look at our website and look at the indicators that we are tracking around the world. because it is very uneven at the moment. And our message is to maintain vigilance. So even in countries that have driven transmission down, we need to continue to drive transmission down, because we were in this situation in Europe a year ago, exactly the same position where cases were going down, and we allowed it to increase again, and we really can't do that again.
Thank you, Maria. Mike, do you have any reflections as well on the current epidemiological situation?
No, I think we've seen that major impact in India, Nepal, and South Asia, and now we see this point, in South America, where you see that point of impact. But that's coming behind an increase in cases in the last number of weeks. You get the increase in cases, then you start to see more severely ill patients, then the hospitals fill up, then the ICUs fill up, and that's when the media and others notice that there's something really going badly wrong. And at that point, you're really a long way down the track. You're really firefighting then. And that's when you see people scrambling for oxygen and scrambling to get a hospital bed and scrambling to get the medical services they need in a health service that's already become overwhelmed. One of the primary objectives in this pandemic response has been to protect the health service by ensuring that the number of new cases is kept to a minimum, not only to stop transmission and stop anyone getting sick, but to stop the health system becoming overwhelmed. And it's amazing, a year and a half into a pandemic, we're still not getting that right. Regardless of the existence of vaccines or not, high transmission leads to huge pressure on the health service. What vaccines offer is a twofold benefit. They allow very vulnerable people to be vaccinated, and therefore they don't get as sick, or they don't get sick at all, which means they never end up in hospital. Or it also helps to stop transmission, which means people don't get infected in the first place. Our problem is that vaccines are distributed so unevenly in the world, so completely unfairly in the world, that the impact of vaccines we're beginning to see in developed countries, highly industrialized countries. What we're seeing in the developing world very often is exactly the opposite. High transmission turns immediately into high numbers of deaths, high numbers of hospitalizations, because we haven't got vaccine as a firewall between the virus and its impacts. And countries are left very much with having to deal with this pandemic with those traditional means of public health and social measures and physical distancing and masks and appropriate good ventilation and in doing contact tracing, because they don't have vaccine as a way of managing the outbreak. You need both. And you'll also see that in countries that have high vaccination levels, some still have very significant transmission and could easily turn the corner in the bad direction. And we've seen some countries, even with high vaccination rates, have increases in the number of cases in the last week or two. So no one's out of the woods. We keep saying it. We need to match our public health and social measures, our ability to reduce our risk of being infected, our risk of infecting others, what we do, our behaviour, what governments do to support our behaviour in terms of physical distance, mask wearing, ventilation, opening windows, making sure you get tested if you feel unwell, making sure that you cooperate with contact tracing, making sure the system can do enough testing in the right places. All of that's important, even if you have high rates of vaccination. And I think where you see the two come together, that's the way out of this pandemic for us. If we can continue to sustain good public health measures, and we add vaccine into that, and we increase vaccination everywhere, there's a way out for all of us. At the moment, this is one of these traps in which there seems to be only a way out for some people. And that's essentially just not fair. And it is tragic for me. I'm very happy to see the numbers going down, Alex. It's nice to see 5 weeks of reduction. It's nice to see that the overall trend of the pandemic is downwards. It's very worrying to see many countries still suffering huge increases and having to put in place lockdowns. In Malaysia, which has managed this outbreak extremely well up to now, is having to put in place lockdowns because the transmission is growing. It's very hard to sustain those measures for a year and a half, 2 years. But I'm happy to see the overall progress. Worried about the pockets where we start to see increased transmission, but just very saddened that there are still health workers in the front line treating COVID today who are not vaccinated because there's no vaccine for them. There are still vulnerable people with underlying conditions who are not vaccinated. If they get sick, they may die. there are still our oldest and wisest people in our society still not protected from vaccines. And to think right now, there are enough vaccines in the world right now, without producing another vaccine. Right now, there are enough vaccines to protect all the vulnerable in the world, to protect all the health workers in the world. This is a real test of our resolve as a civilization, because we can end this pandemic. We can certainly end this phase of the pandemic, this acute phase, very, very quickly, if we choose to. It's how we choose to move. And I suppose looking at the epidemiologic situation, it may reassure some people. It certainly doesn't reassure me, nor you, Maria, I think, because it can lull us into a very false sense of we're making progress. We are making progress. The problem is only some of us are making progress.
You hear us say a lot about this comprehensive approach. You hear us say a lot about this toolkit, all of this. It's about decisions that leaders make right now about how they use available resources, how they use those vaccines, if they donate those vaccines to those who need them around the world. It's about companies making decisions about making workplaces safer, about being flexible about work arrangements, which we've seen around the world completely transform with how people go to work or work from home where they can. It's about individuals and the decisions that they make, knowing their risk, lowering their risk, using that toolkit. That's not changing. I mean, I think a lot of people want to hear us say different messages and say different things out there. Maybe you're tired of hearing us say the same things over and over again, but we can't forget what works. And these are proven public health measures which each of us has some control over. And as Mike has said, though, it's so hard to sustain. It's so hard to keep up. But if we let our guard down, we're just going to go into this zigzag, this flip-flopping of really intense needing of these so-called lockdown measures and then opening up. We can't continue to be in that. Vaccines and vaccinations are an incredibly powerful additional tool. They are not the only tool. And this diversion that we're seeing in countries that have and countries that don't have is really, that divide is becoming more and more deep. And that's creating different situations around the world. We have multiple situations around the world with intensity of spread, vaccination, access to vaccine, access to be able to carry out vaccination. And it's causing a divergence that we're seeing that is really grotesque. And that makes communicating about this harder. You've asked one question so far, and we're spending 10 minutes answering that question because it's so challenging to give a short, succinct answer. It's different, but we need to be strong. We need to look out for ourselves, give ourselves a break, and take care of our own mental health and well-being and care for our loved ones, but continue to take the measures that keep us and our loved ones safe. Don't just do it for yourself. It's not just about you. It's about you and your loved ones, your community, where you live, where you work, everything. And every decision that we make, every decision community leaders make, has an impact. And it's still dependent. Those decisions really tell us how long this pandemic is going to continue.
Thank you so much, Maria. And I will take a follow-up question from a Twitter viewer. How will WHO protect the population that has not yet been vaccinated or those having health conditions that cannot be vaccinated?
We want to see them vaccinated, and there's no reason why they cannot be. And this is why, and we do thank those countries who've really stepped forward now with dose sharing and beginning to share some of their excess doses in their countries. We're working to get production increased. We're seeing the various waivers on intellectual property, but also important removing trade restrictions on ingredients and precursor products that are needed to produce the vaccines. It's like everything in life when you have a problem. It's not one thing. There's a number of things you have to change. And if you change a number of things at one time, you can change the outcome very significantly. So we have to work on, we also have, I think, 4 new vaccines going into phase 3 trials on the WHO Solidarity Trial Platform. So more new vaccines, accelerated research on those vaccines, increase production in the existing facilities, transfer technology to new companies, subcontracting to get more companies involved, waivers of intellectual property, increasing or decreasing the restrictions on ingredients and precursors, and then ensuring, for us primarily, that we can work through the COVAX facility. I mean, the COVAX facility is a fantastic facility. It can provide vaccines to almost every country in the world. The mechanism is there, it works. We've worked through with the countries how then to use that vaccine at national level. We've validated the national plans. We've looked at their cold chains to see that their workers are trained. We're ready. The system is ready. What the system is missing is vaccines. And there's two things that get you vaccines: production and money. And right now, both are a problem. And WHO has called out, you'll have seen the leaders of the IMF and the World Bank yesterday clearly making the economic argument. Even if this isn't about humanity, even if this isn't about morality, even if this is not about saving our fellow human beings, it makes massive economic sense just to do this, because this will get the whole world out of this so much quicker. We'll save trillions of dollars just by doing this. But I hate making that financial argument, but this is the way out. So yes, and there's an awful lot of that happening. We're pushing on every single pressure point that we can with our partners in Gavi, with our partners in UNICEF and in CEPI and others. That has to happen. But I think the quickest way right now, given the issues with production and given some of those longer term issues, one of the most effective things right now is to have governments who have excess doses to contribute those doses to COVAX so we can get them out to countries quickly and get this real push, this real sprint to try and at least get the most vulnerable people and our health workers all around the world. If we at least push to that, let's agree that the most vulnerable, older populations, people with underlying conditions, and frontline health workers, can we agree that they all need to be vaccinated right now? And if we can get enough vaccine pooled and enough vaccine pushed out through the system, as I said, that already exists, the system is there. It's been tested. It's already produced, sent vaccines to 126 countries. So the system is warmed up and ready to go. And a lot of that is a testament to all of our partners and the countries who put a huge effort into doing this. We're missing the vaccine.
Yeah, where there's a will, there's a way. We have the way, we don't yet have the will, exactly. Which is what the DG said yesterday. But also in the meantime, while all of that is happening, what we are doing is we are working through our regional offices and our country offices to support governments in implementing this comprehensive approach, this strategic preparedness and response plan that has been outlined since last February 2020. And it's all of those elements, ensuring that there's good testing, there's good surveillance, so that we know where the virus is circulating, we understand where the most intense spread is, getting test results back quickly so that public health action can take place, so that individuals can get into the clinical care pathway quickly, they can be assessed properly and cared for based on the severity of their symptoms, making sure that they are isolated away from other people so they themselves cannot spread to other people, that there's contact tracing systems in place, that workplaces and homes are safe, we have good ventilation. It's all of that is happening as well. And we're so grateful to our country staff, our country office staff, all of our partners in country who are working with ministries of health, all of the community health workers, the frontline workers, health and care workers, carrying out all of those other measures. So it's that whole combination. So the viewer who is watching to say, what do we do? It's all of that is taking place. And also trying to ensure that individuals are empowered and enabled to carry out the functions to keep themselves safe. For example, if we say stay home, or if the government says, work from home or stay home, families need to be supported in doing so, so that they don't lose their job and so that they have food on the table. And so all of that is happening as well. And we as WHO are working with so many people around the world to carry out all of those actions. And that's what needs to stay. When we say stay the course, this is what we mean. We mean stay the course in this comprehensive approach, making sure that all of those elements are in place, and that we don't lose that momentum. I know people are tired of this, but we really need to remain on guard and kind of at the ready, so that the virus doesn't have an opportunity to resurge.
And just on that issue, the staff in this organization at all levels and our partners are heroes, because they just work 20 hours a day, 7 days a week, and have done for a year and a half. The difficulty we have this year for WHO is not like with any organization, is that people are tired. But that's not what exhausts us now. I think we're more frustrated than exhausted. And not only that, but we're in a difficult situation too, because the world does and rightfully expects us to do this work, to set the norms, to make the standards, to bring the science together, to support countries, to coordinate, to facilitate. That's our job. But it's difficult to do without resources. And we had an appeal out in January, February for $1.9 billion. Of that, about half has been pledged. Of that 900 million, about half has been received. And of that half received, which is about $450 million, I think, 85% has been earmarked by donors, which means it's been specified for special projects, special countries, special circumstances, which means only about 15% of the 50% of the 50% is actually at my disposal, Maria's disposal, the DG's disposal, to spend in the new priorities. So when the disease shifts and we see the impacts in India and Nepal, or we start to see the impacts in South America, we just don't have the flexibility to move. We can move people and we can move our focus there. We can shift our telescope and we can shift our focus onto that region. But we find it exceptionally difficult now to provide the extra resources that our country offices and those countries need. So there is a it's not just a gap in funding for vaccines. There's a serious gap in global solidarity around funding this response, be it for vaccines to Gavi or be it for technical and support operations for WHO. So to me, there's a huge gap between the rhetoric and the reality. The rhetoric of everyone saying this is hugely important and we must do something, but the reality is the organizations that need to get on and do that are not adequately funded. The systems like COVAX are not adequately funded. It's a real challenge right now, and we know that it's tough. This is not easy for governments and donors and others, but it's a very, very challenging situation right now because we're facing into a really uncertain period in the pandemic. We're facing into a terribly uncertain period in terms of the financing to keep this all going. And that's just the reality. We're not complaining. We will work 24 hours 7. We will work every single day. But it's our ability to shift and put new resources into specific countries and specific areas when we need to. We have a very concerning lack of flexibility right now.
And to deliver.
Yeah.
The expectations are very high for us to deliver.
Actually, the next question that we've been receiving throughout the week is through different channels is, what is WHO doing to support countries like India, Nepal, Malaysia, Argentina? So these are some of the parts of the world where you mentioned that the situation is critical at the moment. So you explained the constraints. So how do we support them, and how do we provide the support they need?
Maria will maybe speak to the technical and the scientific side. She's a much better scientist than I am. Maybe just to give you a sense, we're present in 152 countries. We have WHO operations in 100. That's all the time. That's before this pandemic. So first and foremost, we are embedded in our member states, working hand in hand with them on issues all the way from child health, maternal health, sexual and reproductive health, emergencies, epidemics, diabetes. We're there. So we don't just come and leave. We're there. We have 6 fantastic regional platforms in our regional offices with our regional emergency directors and regional directors. And those platforms provide a lot of our direct technical and operational support through our country offices to the countries. Headquarters here has a different role, and I'll explain that. But we owe an awful lot to our frontline country offices, to our country staff, and to our regional offices and our regional staff, who are the ones out there really pushing to support countries. They are the ones who are able to translate all of that material and guidance that we produce here and push that to countries. We also provide global services in surveillance and in training. The openwho.org platform has trained, I think, nearly 5 million or maybe just over 5 million people now. So we're really trying to exploit all of the new technologies in order to bring training and guidance and the best practice to people in countries. We do a lot of direct technical and operational assistance. We've deployed At this stage, hundreds of emergency medical teams. The Global Outbreak Alert and Response Network has deployed teams to countries. So we often deploy specialist teams. If a country needs an EMT, as we call it, which is an emergency medical team, which knows how to treat COVID, can work in an isolation facility. Not only have we sent the teams, but we've built the facilities. In certain countries that are fragile and conflict affected, they haven't had the capacity. So we go all the way from helping countries design an isolation facility. For example, a country can contact us today and say, we're thinking of building an isolation facility and we've only got 600 meters squared at the back of the hospital. They can send us the photograph and we can actually work with them in a network of architects called Techni, and we will produce the CAD drawings and everything to be able to send back to them and saying, this is how you should build it, this should be the design. But we can also send engineers to help them do it. And we can also, if needed, send an emergency medical team to staff that. We can't do that for every situation. So we have layers of different types of support. Same on epidemiology. We produce guidance on contact tracing and surveillance, but we also produce standards for laboratory testing. But we also procure and deliver laboratory tests, and we also help countries directly with data analysis. So countries can go to our country offices and get direct support on analytics. And then we can send epidemiology teams to do outbreak investigations. So we try to make sure there are layers of support. Some of it's remote, some of it's on-site, some of it's very intense and very bespoke to the needs that the country have. We have a country platform. We've built a COVID-19 country partners platform. On that platform, each country has a strategic preparedness and response plan. From that plan, we can break out that plan and look at the needs for supplies, their needs for technical support. The donors also put their plans to support their country on there. The vaccine plans are on there. The portal for ordering supplies and the COVID supply chain is on there. So countries are very much in control. And then obviously for specific situations like in India and Nepal, we've sent, I think for India, over 4,000 oxygen concentrators. We've sent tents, I think, doing very similar work with Nepal. We've sent an injection of finances into our country office in Nepal so they can support local training. We've began, I think, training lots of local doctors and nurses in isolation facilities on applying standards of case management. Our colleagues in the Pan American Health Organization, which is our regional office for the Americas in Washington, are hugely involved in the countries in South America. In general, many countries in South America have very strong health systems historically, but like we've seen all over the world, many health systems have come under extreme pressure. Our country representatives there and our country teams continue to work. So I'm going on a bit. I don't often get a chance, Alex, to talk about what we actually do, but our support goes, all the way from having a global scientific meeting on diagnostics or variants, right the way down to running a community engagement course with local NGO leaders in Somalia. And our work is everywhere in between. And that's across all of the countries. So it's an incredible geographic dispersion of activities, a huge depth of activity, and then each of those activities, according to epi, clinical, laboratory, community, education, so many other things. So it's we try, and I have to be honest and admit, we don't always succeed. We have very limited resources. We're limited in size. We're limited in our mandate. We can't impose our help on anyone. Our help is given at the request of our member states. And we try our best. But this pandemic has been probably the biggest, I would say, challenge this organization has ever faced in terms of the demands on the system. And we could not do that without our partners. When I say about emergency medical teams, they're not working for WHO. They're networks of doctors and nurses in hospitals all over the world who deploy themselves with the support of their governments to other countries. The partners in the Global Outbreak Alert and Response Network are institutions all over the world who provide their people free of charge to us to go all over the world. The people on the Virus Evolution Working Group or on the Infection Prevention, all these experts who sit in these committees, and they spend hundreds of hours advising us. None of them are paid. None of them are rewarded. No one will ever know their names. Well, unless you go into the WHO website and find them. Yeah. These people are doing selfless work. on top of the work they're already doing for their own, in their own countries and for their own communities. They're heroes to me. And that, for me, is the essence of what WHO does. Our job is to connect people, connect data, connect systems, connect science, connect all of that together. Ourselves as an organization, we're very small, and we do not have the financial power or the political power to do things that people expect us to do. We make do with what we have, and we leverage every single asset, every single resource. We call in every favor, and half the time it's our superpower is that. And yet we still fail, because we still fail to meet the expectations of countries. Because sometimes the scale of these crises, and it doesn't matter if you're talking about COVID or you're talking about Ebola, or you're talking about these brutal humanitarian crises in countries like Mozambique and in Tigray and Ethiopia and in Myanmar and other places. You know, no organization, in a sense, has the capacity to fulfill all of the needs of populations who are living in these extreme circumstances. So our program deals with COVID, Ebola, humanitarian emergencies, so many other things. But again, we thank, you know, and when I did speak earlier about funding, we would like to really thank those donor partners who do so. We appreciate every single dollar, every euro. We appreciate every single one of them, because they make a difference, and we make that funding count. So again, thanks to those who continue to support us in the work.
Can I just add something? Because I just wanted to highlight how you hear the frustration in our voice when we're talking about COVID, but as Mike was just speaking, you heard that frustration turn to pride, you know, in what we do. We love what we do. We may not love it every day, but we love what we do because we work with incredible people around the world, not only WHO staff, but partners. And I do really think this is our superpower, because in the 12 years or so I've been working with this organization, I've never had someone say no to us, to work with us, to carry out some research, to collaborate, to inform, to advise, to constructively criticize. I mean, we've never had people say no to us, because we are the World Health Organization, and we are, the sum of our parts. We're a member state organization, and we are proud of that. We don't always get it right. We don't always do it to the best of our ability, but we try to the best of our ability. And that is something that we continue to do day in and day out for COVID-19. And what we need in this response is we need every single person on the planet to be part of the solution. Every single person on the planet is, can be, should be, must be part of the solution. And if you don't know what it is that you can do, reach out to us and we'll tell you what you can do and how you can, but predominantly keeping yourself safe, minimizing your exposure to this virus, minimizing your opportunity to spread it if you're in an area where it is circulating is really critical, because all of these decisions matter. If we can really collectively focus at a global level and really have an intense focus of ending this, using the tools we have right now, we could end this very soon. It will take months, but we could do this. We just really need that sort of collective focus on doing so. And we all want to be out of this. So then you won't have to see Mike and I do Facebook lives or Twitter lives or all of the different social platform lives anymore. I know, maybe there's nobody watching anymore. Maybe our families are watching, we'll see.
There are a lot of people watching and still submitting their questions, and definitely this emotional response that we've got has been noticed, because someone wrote, Dr. Ryan speaks from the heart. So definitely, and I'm glad, Mike, that you did this, because as you said, the expectations are high, and sometimes expectations are higher than what our power or mandate is to do to support. So I think it's important as well to clarify what exactly our role is, but as well where are our limitations to meet all the expectations and demands around the world. Here is one question. There are two questions that I think we could share some updates from the World Health Assembly that has finished just now. One is why international health regulation is not implemented strictly by member states. And the second one is, what will be done to avoid other pandemics in the long-term future? Are there any international plans? So maybe, Mike, you can start with these questions.
Yeah, we could have a very long Facebook.
Yeah.
Go to much through that. But it's a fascinating subject, and we could have a whole Facebook on it.
Probably should.
Yeah, I think we've seen this disease emerge, but many of us have seen other diseases emerge over the last 10 years. Very dangerous diseases that could have spread around the world, and some of them did spread around the world. And I think what we're witnessing is this silent emergence of disease that's upon us before we know what's happening, right? So that's that breaching of the species barrier on a planet that's completely, what would you say, a planet out of balance. That's essentially where we are. We have an out of balance planet. We're engaged with animal kingdom, and we're engaged with the environment in an extremely dysfunctional way, in every aspect. How we manage animal husbandry, how we manage food production, how we manage our relationship with the ecosystem that we inhabit. And in doing that with population growth, with population movement, with people living in poverty, with exploitation of pristine environments, we really are out of balance. We're, in that sense, out of control. And the result of that, and there are many results of that, like climate change. But one of the results of that, apart from lots of social inequities around the world and a planet that's heating up, is a planet that's very unstable ecologically, very unstable from the point of view of biologically, very unstable. And that means that these usually animal diseases are pushing across those barriers into humans. And that's happening. Second problem is our systems to detect those are weak. Mm-hmm. And the very things that should stop those diseases, like hospitals in many parts of the world, have very poor infection control, and in fact can amplify these diseases. If these diseases get into poor, overcrowded suburbs, or these diseases get into poor, overcrowded camps, disease can spread quickly. And then, with all of that happening in a given country, we've connected the world up in a 24-hour round-the-world airline and other connections. So we can disseminate diseases around the world in a day. So we're creating this really, really converging risk. I often think of it's like, huge trucks on different motorways, and they're all heading for the one spot, and you know there's going to be a big pileup. And I think that's where we are. And I think this pandemic reflects a lot of that. The inequities that we see, both in terms of who's dying. It's not just who's getting the vaccine. The people who've died in this pandemic, many of them, had many, many, many years of unmanaged underlying conditions, probably because of income, race, ethnicity, have not had the same levels of access to care and prevention and promotion, and are suffering the consequences. So the consequences in this pandemic of inequity and social inequity, both in terms of the disease severity and in your likelihood to get a vaccine, are very similar. And with all of that, happening and what the pandemic has uncovered, I think our member states have really had a real think about this in the last few months. And what they're saying very much is at the World Health Assembly, and I'm paraphrasing this, is yes, we have to end this pandemic. And a lot of the discussion was around how we're going to solve the vaccine problem, how we're going to get rid of this bug. But equally, at the same breath, they were saying, but the time to act is now on the other big things. We can't end up getting amnesia, that we end this pandemic, we all go back to normal business, and we forget. And I really do not want to be on this planet in 25 years' time when someone says to me, do you remember the pandemic? And I go, which one? Mm-hmm. For most people's minds, this is the pandemic of our lifetimes in that sense. But it could be repeated. And I think everyone's woken up to that reality. Everyone's woken up to that brutal, brutal reality. But in the same time, we've seen something special. We've seen that interconnectedness, the thing that connects us and makes the bugs move around, is actually one of our greatest strengths. The way we can connect data and connect science and connect communities and connect decision making. So we can do better, faster, we can be stronger, we can be better at prevention, better at preparedness, better at response. We can produce vaccines in record time, we can produce diagnostics in days. That there's something quite, we gotta sort of in some senses put the weaknesses and our sort of frailties on one side of the equation and our strengths as a human race on the other. And the goodness and the willingness. We often talk about misinformation and we talk about people who undermine the system, and that's the negative. My experience is the vast majority of people want to do the right thing. They want to be part of something. They want to be part of something good. They want to be part of something new. They want to make the world a better place. They want a safe planet. They want a safe society in which to raise their kids. So I think that realization has really come home with our member states, that we have to both end this pandemic and prevent the next one. And that's really the essence of what's coming out of the Assembly. And you'll see they're planning a special session, a whole World Health Assembly at the end of November. I think it's the 28th of November, 29th of November. So we're going to have a whole World Health Assembly just on this topic of having a treaty, a convention, an agreement between all member states in the world, between all countries in the world, about how to stop the next one. And that's a big outcome. You know, the time is, we're going to, so that for me is fantastic after so long working in this field, to see that political commitment to doing that. Will it all happen the way I would like it to happen? Probably not, but that's life. But the fact that we're seeing that political commitment is incredible. And seeing the same thing on the climate side is really gratifying. You know, we live in on a planet within a biome, a biologic ecosystem, right? On a fragile planet. And right now, they're the two things we absolutely must take care of. We must sort that out. And the levels of exploitation on our planet, the level of exploitation on our peoples, has just got to stop. We've got to find a better balance. We've got to find a better way, a fairer way. And you know what? The fairer way is the best way. And if we can find that way through, and that's obviously will require a treaty. Someone asked about the IHR and why aren't countries implementing it. For the most part, countries are implementing the IHR. The IHR called on countries to develop national action plans for public health security. And in developing countries, over 80 developing countries went through the process. They did an external evaluation of their system, they devised national plans, and they reached out to the international community for finance, and none of them were funded. So they were trying to implement the international health regulations, but they never got funded to implement that. So we have to find the solutions to that. How are we going to put in place financing mechanisms, domestic and international? How are we going to incentivize countries in order to invest in national public health security? On the reporting side, yes, most countries are very good in reporting to WHO. We have very good intelligence systems in parallel. Some countries are not so good. It's a constant struggle for us to emphasize to countries that it's their responsibility. And this is the thing, the IHR puts the responsibilities on our member states to assess all of the signals at a national level and ensure they inform WHO in a timely and comprehensive fashion. For the most part, that happens, but it could be improved. And there are systems we can develop that will enhance that capacity at country level. We've announced, the DG announced very recently with Chancellor Merkel, the establishment, and Minister Spahn in Germany, the establishment of a WHO hub in Berlin that's really going to focus on global surveillance and new tools for analytics and detection. We've had the announcement from Boris Johnson at the G7 around the pandemic pathogen surveillance initiative, which I think Boris called a pandemic radar. We're working with them and with the Germans and with others on how we build new momentum around that global surveillance, not just relying on the legal aspects of the international health regulations, but developing the technologies we need to do that work better. And that's just one part. Then we've got the health workforce, we've got supplies, and we've got the health system and how the health system stays. I mean, this is a complex issue. But what I'm glad about is that there's now a political direction. People understand that it's not just about ending this pandemic, it's about preventing the next one. And we need, and I hope half the reason I do these Facebooks is we're talking to a great number of younger people out there. It's time to wake up and it's time to act up on this, you know? If there ever was a reason for the youth to put their hands up and say, enough already, it's now. Your planet, it's your ecosystem, it's your biome, you're going to have to live in it You're going to have to raise your kids in it. And you need to hold us to account to fix all we broke. Because this planet, from that perspective, needs fixing. And it's going to require a kind of a generational commitment. It's not, the DG said it in his speech, it's not one media cycle, it's not one financial cycle, it's not one political cycle. This won't be solved in 4 years. It won't be solved in 4 minutes. It won't be solved. It will be solved in a generation if we do all the right things. And I think that's where we need young people to really, in their minds, link. You know, there's social justice and climate justice and health justice are linked. They're connected. They're the same thing. And we need the younger people to really lean in on this and really take this on and take this over. And
Part of the solution.
yeah, and drive it. I mean, yeah, it's for me that's going to be key, because as we move forward, all of us, you know, we get distracted by the next thing, and politicians and others get distracted. It's people saying to us, sorry, no, sorry, you can't forget this. No, you need to focus on this. Sorry, we want this fixed. We're not done. You need to fix this.
We're not done yet.
And there's no one better than younger people to force that, and to force that issue and keep the issue on the agenda. Keep this issue as a hot central issue for everyone in society. So again, I've gone on a bit, Alex, but I don't, as I said, this is great. I normally don't get to go on and on about non-science issues, but
I think it's good. I think it's good. People get to hear this part of it. But I think sorry, if I could just very, very briefly add, is my big fear right now is that we, you know, just on that last point, is that we follow through. My big fear right now is that we just move on to the next problem and we don't fix the problems that we're seeing right now. And it isn't something that's going to be done quickly. But we are all dealing with something that is incredibly traumatic. And we're going to forget. We're going to forget. Some countries are already mentally done with this pandemic. They're moving on. They're moving on to the next crisis. And some of you are watching know exactly what I'm talking about right now. But I've seen in a lot of countries, they have not taken those steps to actually put the systems in place to prevent that next one or to be better prepared. So if we don't use this trauma now to make those changes, when will we? And that's one of my biggest fears right now, is that we won't use this horrible situation to build systems that will make us much, much better prepared and turn the next spillover event into a small outbreak that does not need to turn into a pandemic.
Thank you, Maria. I'm conscious of time, and I need to pass you a few more questions. These are for you. Has any variant been proven to be more aggressive or infectious in pediatric patients? And one more, you're gonna love this.
I love it.
Which are the countries found by Delta variants and the strength of transmission compared to other variants? So please update on variants, but also what do we mean by Delta, and what are the news we released earlier this year? This week, not this year.
This year, yeah.
I'm lost in time,
Alex.
sorry.
No, that's fine. So we announced a new naming system for the variants of concern and the variants of interest that WHO classifies at the global level. And we're using the Greek alphabet to do so. And our objective is really to just have easy to use, easy to remember names of these very complicated scientific names of viruses. And so we have 4 variants of concern. We have the alpha variant, which is the B117, first identified in the UK. We have the beta variant, which is the B1351, first identified in South Africa. We have the gamma variant, which is the P1 variant, first identified in Japan from Brazil. And we have the Delta variant, which is the B1617.2, which was first identified in India. Now you'll notice I didn't say country X variants. The reason that we're trying to use these easy to use names, this Greek alphabet, is to remove the stigma associated with the countries that are carrying out surveillance, that are sharing that information, and making this known around the world. Because there are some that are using this and saying Indian variant. We don't want to hear that anymore. If you can say the Delta variant, and I thank the viewer who called it the Delta variant. All of the variants of concern have increased transmissibility, demonstrated increased transmissibility. And you have to remember that the variants of concern are a number of different mutations. It's not just one mutation. They have a constellation, a combination of mutations. And the B1617.2 is no different. This variant of concern has some properties that allow the virus to adhere, for example, to the cell more easily and infect the cell more easily. And that's what we mean by increased transmissibility. And if you have increased transmissibility, you can have cases grow very, very quickly, which will burden the system quite quickly. The Delta variant is being identified in a number of countries around the world. I don't have the latest number of how many countries right now in front of me. We can probably put that below in the chat. We have not seen any of the variants of concern target children. So there isn't an intrinsic property of the viruses that specifically target younger age groups. In fact, what we do see is that if the virus variant is circulating, if there's increased social mixing, whichever age groups are mixing, they will be infected by that variant. So it's not specifically targeting younger children. So that is good news on that respect. And children still overall tend to have less severe disease and have fewer related deaths. So that is still good news around the world, although that's not universal. So these variants are circulating, and we do have a website that we have posted around the variants. So if anyone is interested in these new names, you can see there. And we release really detailed information on where the variants are circulating in our weekly sit reps that are published every Tuesday. So that's updated every week. And we also provide a summary of what we've learned from the literature. What do we know about transmissibility? What do we know about severity? What do we know about the impact on diagnostics, therapeutics, and vaccines? So with all 4 variants of concern, our public health and social measures continue to work. Our diagnostics continue to work, so they still can be detected. Our therapeutics are working, and our vaccines are working against severe disease and death. And this is really, really critical. So when it's your turn, get your vaccine. Make sure that you carry out all of those other individual level measures to keep yourself safe. But one last point is that around the world, we need surveillance to continue. We need genomic sequencing to be carried out. This needs to be done in an intelligent way so that it's not every case needs to be sequenced, but it needs to be a subset of the cases that are circulating in country, and that information needs to be shared on platforms like GISAID and others, so that our virus evolution working group and others around the world can analyze this and look to see, what are the trends, what's actually happening. So we rely on countries, and there are really good regional platforms that we are working with our regional offices to enhance, as well as many different partners, the Gates Foundation and Wellcome Trust and Rockefeller and Public Health England, and I should never start naming because I will forget to name a bunch of them, but a lot of people are interested in sequencing right now. So we're using this as a catalytic moment to really enhance this system for the long term, not just for SARS-CoV-2, but for all infectious hazards and pathogens going forward, to build a better system going forward. This is another example of how we can do that.
I know something Maria doesn't know. 62
countries
with the Delta.
There you go. That's why he's the executive director.
Thank you, Mike.
For once.
Thank you so much. There's one more question.
Proud of that.
Of concern, as a lot of variations on the questions on the issue with black fungus infections in India that we received, and correlation with, are there any correlations with COVID-19? So maybe Mike, if you can clarify for a lot of our viewers who have been asking us this question or range of questions in the past week.
Yeah, the event and these reported cases have not been fully investigated yet, but certainly there was a very acute increase in the number of reported cases of what's colloquially referred to as black fungus, but it's actually termed mucormycosis, which is a form of fungal infection. It's really only known to infect people who are severely immunocompromised, people whose immune systems have been compromised for any number of reasons. It can occur in patients with severe diabetes and patients on immune therapies. And certainly in this case, and it's a normal environmental contaminant, or it exists normally in the environment, and it's usually of no consequence to humans. But the spores can be inhaled into your lungs, they can be into your sinuses, they can go into your eyes. And if you are immunocompromised in that situation, they can really grow and cause a tremendous number of problems. Our concern in this case is obviously people who have COVID are already, their immune systems are under pressure. Many of those individuals need to receive, of the severe cases, need to receive steroids. And you've heard the different names for corticosteroids that people receive. And dexamethasone is the one most people will have heard about. And they're hugely life-saving. I explained here before how these steroids can shut down, and what they actually do is basically suppress the immune system to stop the immune system overreacting, which causes a lot of the inflammation that stops the oxygen going from the lungs into the blood. So it's life-saving. What you're doing is modulating the immune response and settling it down. The problem is, if those drugs are overused, if those drugs are used in too high a dose, if they're used for too long, they can have exactly the opposite effect. They can weaken the immune system. So our concern here is that the more widespread use of these drugs, for example, outside the context of a properly managed hospital where patients can be observed and where patients can be treated with what are actually reasonably low doses of steroids for a very short period of time to help them through the most critical part of the illness. This isn't about treating people over weeks with steroids, and our concern is that if patients have been receiving steroids, particularly people who have underlying conditions like diabetes, that they could really have resulted in severe immune suppression. Now, none of this, these are all associations right now, and clearly the reports are very, very significant because this can kill you. And it often requires, therapy with very specialized antifungal drugs, and often very big surgery because the fungus sometimes has to actually be cut away, and that's quite horrific for patients. So this is serious disease, and it does mean, again, and we've said this again and again, and sometimes people, we talk about oxygen and we talk about therapeutics. In the end, oxygen is fantastic, but oxygen in the hands of a trained medical worker who knows how to use it, where to use it, right? It's exactly the same with drugs like steroids. They're fantastic drugs for the right patient at the right time during the course of their illness. They're very dangerous outside that context, and therefore we have to be very careful. So it's not just the existence of a drug that saves lives. We've seen the same stuff with bleach and with disinfectants. They're fantastically useful for cleaning the floor and cleaning surfaces, and sometimes in low doses cleaning your hands. They're not so effective, and they're damn dangerous if you take them inside your body or ingest them. So in that same way, it's really important that we should only be using steroids to treat COVID-19 at the instruction of a trained health worker who knows how to use those drugs properly, because it's not something that should be happening. Now, there are lots of other reasons why people can get this infection, and India is a huge country with a massive population, so there may be other underlying reasons why this fungus infection is causing a problem, and we will be working through our regional office in Delhi and with our country office in Delhi and with the Indian government and scientists to further understand this. You may have more info, I think.
No, I think for the viewers to know that this is something, that we are learning about. It's not something that we've seen in all countries around the world. It's very specified right now in India, and we have heard of, I think, in one other country as well. But it isn't something that is rampant. And what we want to do is we want to better understand it. We want to better understand why it's happening so that steps can be taken to minimize what's happening already and then prevent it from happening elsewhere. So we don't want the viewers to think that this is a new thing, that is spreading around the world, but we have to be careful. There are interventions that are in place, but they do need to be used properly, as Mike has said, in the right dose for severely ill patients, not for everyone. Those are just as life-saving as having the drug itself. So, be safe out there. Take care when you are self-medicating. Do not be self-medicating with these types of treatments. And as best you can, use the hotlines that you have. Seek the medical care that is available in your country. Ask the questions.
Thank you so much for clarifying this last question. We can make it short. Yesterday was Parents' Day, and the month of June is Parenting Month. So you're both parents, but you're also public health experts. So what is your advice for the parents out there in the world who live in the countries with high transmission to protect their kids, but also for those who live in those countries that are opening up and school break is approaching, how to keep their kids safe in this for some countries where the mindset is that the pandemic is over and we still need to stay vigilant.
Knock us about.
It's
Is there a bad Parents' Day?
And it's good you did say experts at being parents.
Yeah.
So that's
Yeah,
good.
yeah. Experts who are also parents.
Experts who are also parents. Yeah. No, I mean, listen, I don't want to give advice to parents. I mean, they do the best that they can to keep their children safe in every day, in everything that they do. COVID is one aspect of what we are dealing with. And it's about the measures. It's about, following the local advice. And in many parts of the world, schools are open again, which is really great. And it's about teaching the kids, listening. I mean, part of, I think, what parents need to be able to do is to be able to talk to their children as best they can through this incredibly challenging time. It's confusing. It's scary. Life is on hold. For a lot of them, I have a very, very little one, and I have a 10-year-old, and my 10-year-old hasn't had a play date in 18 months. That's a very small sacrifice that my little one can make to keep himself safe. And we do everything that we can. If they're of a certain age and they're asked to wear masks, teach them how to wear masks properly. Make sure that their hands are clean and that when they're touching the outside of their mask, that they don't manipulate it a lot or touch their eyes or nose. I mean, all of those types of basic fundamentals, how to wash your hands properly, which is not only good for COVID, but it's good for many, many different pathogens. These are sort of lifelong activities that people need to do. But in all honesty, I think the best thing that parents can do is really just continue to listen and do the best that they can. Parents need to give themselves a break too, because this is very difficult. A lot are still working at home. They have kids at home. They're balancing life and home and schooling, and it's difficult. So day by day, get through every day. Find something fun to do every day. Find some way to laugh with your kids every day, and make sure that as parents you take some rest too. I'm telling that to myself as much as I'm telling that to parents who are out there.
Yeah, it's. I think for me, if I was giving advice, and not that I'm a great one to give advice, if my kids, Katie, Circa, and Tom would probably be better to judge my parenting skills. But I think the first thing we should all do as parents right now is thank our kids for the sacrifices they've made over the last 18 months. This has not been easy for them, in terms of their growth, in terms of their development, in terms of their mental health, in terms of reaching really important life goals. And if that's just missing a school dance or missing a school play or missing going away on a trip, those of us who are older can remember those 5 or 6 things in our youth, and some of those moments have passed some of our kids by. And that's, I think, the society as a whole, but parents, on behalf of a community, should thank our kids and our youth for what they've done, because too often they're blamed. You see it every time kids have a party somewhere, it's on the news, youth party, and no one is actually saying, well, actually, that's the extreme outlier. The 99.9% of kids and young people have made tremendous sacrifices to protect themselves, to protect their parents, to protect their grandparents. And I've seen some amazing acts of love by kids, especially for their grandparents. So we need to thank them. We also, though, need to listen to them and hear, and actually listen to how they have suffered and listen to what they need now to come out of this pandemic. And it's not just a vaccine in the arm, it's more, because they have to adjust. They have to adjust to going back to school, going back into society. There's kids, in a way, who've stepped away from society. For some, that's been traumatic. For some, that's been a relief from bullying. That's been a relief from other traumas in their lives. And they have to face back into that now. And don't underestimate that for some kids. Some kids are going to approach going back to school with great trepidation. So it's really important to listen and understand if they have concerns about going back to parties, engaging with their friends again, because this has been quite isolating for a lot of kids, and that can be tough. So I think that's important as well. And we need to ask our kids too, how can we do better like I said earlier, let the kids tell us what kind of a planet that they want. There are differences, I think, between the very young kids and then the teenagers and others. And teenagers and youth can significantly contribute both to stopping this disease and to driving this disease on in terms of transmission. So I think it's really, really important that youth are see themselves as responsible for helping to stop transmission. It would appear that younger children play a much less part in the transmission cycle, and that's fair enough, and their parents can help them and reduce their risk. But you don't have to be, in 18 you become an adult, but you become conscious and aware of your responsibilities a lot before that. And certainly in the studies have shown that youth and young adults can significantly contribute to transmission of disease. So your individual behaviour, your behaviour as young people is very important. But the last thing, having been one of them myself once, the last thing that any young person wants to hear is adults criticizing them, just criticizing for the sake of it. So maybe parents as a whole, all of us need to be able to sit around the kitchen table and just talk about things. And maybe this pandemic has actually helped us all do that a bit better. For those of you who've been locked up with your families, I would love to have been locked up with mine, and unfortunately couldn't be because I'm here in Geneva and my kids are in Ireland, so that's been a great loss. So I envy those parents who've been locked up with their kids, and I'm sure those parents envy me. But there's nothing more rewarding in life than those moments where you can sit down with your kids and actually have a conversation.
Can I also, we talk about parents, but we have to thank our partners too. I'm not mother of the year right now. I've been away a lot over the last 18 months, even though my family is here with me in Switzerland. I haven't been home very much, and my husband has been the sole caregiver of our two beautiful children, and I am so grateful for him and what he's done and the support that he has provided. I would not be able to do my job without that support. And my extended family and all of that too, but my children and who 2 and 10, Cole and Miro, and my husband have been my support system. In addition to all of you here, you guys are my extended family in many respects, but wholeheartedly am so grateful for my partner, my husband, who's been able to help with this and being that co-parent and primary parent for the last 18 months. So, again, I know you were asking us for advice, but it's not us to give advice, on what parents should or shouldn't do. Do the best that you can. Love your kids fearlessly and protect them in any way that you can. Remember, a lot of children are in dangerous situations right now at home. And we need to ensure that as these societies open up and they get back to school, that they get back to that, their education, that safety, that assurance that they have. And you know what? We will get through this. So reach out, help each other, make those phone calls and just do the best you can.
Thank you very much, both. This was a great moment, and we received a lot of positive comments on everything you explained today. So I thank you on behalf of all our viewers, and I thank them as well for staying with us and staying a little bit longer today. I would just remind, because there were some questions around COVID-19 vaccines, that tomorrow at 6 p.m. Central European Summer Time, we will have a session dedicated to Sinovac that's been listed with the EUL yesterday by the WHO. So we'll have Dr. Kate O'Brien and Dr. Alejandro Cravioto, as usual, answering your questions about this vaccine, but also on other vaccines. So join us. Stay safe. Follow our advice. Follow our social media channels, website for any updates. Thank you very much and goodbye.